In the Wharfdale Community Partnership, we discussed at that partnership level that mental health in children was a concern for us. Whether that was a concern for me, what I was seeing at the surgery, whether it was a concern for just people who lived in the community, what they were worried about with their children. So I wrote to all the schools in the area that children went to, all private and state schools, primary and secondary schools, and asked them if they would answer a few questions for me. And I got really good response rate back. I got more than 90% of the schools wrote back to me or offered to speak to me on the phone with a high level of mental health issues. And they had very mixed views on what resources were available for them to access into. But they were all very aware that it was becoming harder and harder to get any children in a CAMHS appointment. So also one of the schools, it was a secondary school, offered to send out a questionnaire to all their parents, and it was a girls' school, so it's talking about their girls' self-esteem, their levels of anxiety, their friendship groups, and it was a really good source of information. And it was quite shocking, you know, between a third and a half of parents thought their child had a mental health issue. We took that information back to the partnership and talked about what we were going to do with it. And the first thing that we came up with was that at the time, it was very hit and miss which doctor you turned up at as to what advice you would be given. Since the removal of the school nurses, there was no consistent set of advice you would get. If you went to Dr. A, you might be offered certain treatment. If you went to Dr. B, who might be familiar with the area, they might know of loads of support groups, and it was really hit and miss. So that's when we came up with the idea of doing the leaflets for the children, which I wrote with Dr. Natalie Jewett, who's a psychologist, and we wrote 2 leaflets. So one was for young people. So I've got this here, and it was just, it's very basic, but it was 7 things you can do to look after your mental health, and some mental aid, first aid tools, really basic information, but things we felt people might have forgotten. And on the back, there was links to websites and local services and national services to give people an idea of the first port of call. We then did something similar for parents of primary school children, because it's much harder to pitch a leaflet for between 5 to 11-year-olds. And doing that, the teenage mental health leaflet, we got some teenagers to talk to us about the information we put in, and they fed back, which helped us develop the leaflet. So we got that opportunity to talk to them about their mental health concerns and how they were feeling. So that was how we initially started off. Then the primary care network was being developed. The work is a group of GP practices brought together to service a population of between 30 to 50,000 patients. And we'd gone to them to ask for support for the leaflets, but at that time we were also developing within the primary care network, trying to come up with strategies for other ways that we could improve the offer for children's mental health services. So the idea was to bring all the things we were doing together under the Great Minds umbrella and see how we could expand it, see how we could specifically target the areas where we felt there were gaps in the service. And obviously the main gap was somebody for people to talk to with low-level issues, what we could do about that. And we just started employing social prescribers for adults, to be there to help them with really non-medical problems. So you might have a problem with your benefits, you might be suffering with loneliness and isolation and not want to leave the house, have recently had a bereavement, there's so many other things, and the idea is that doctors aren't necessarily the best people to deal with this. And that was working really well, and it was quite a new thing. So we decided it would be really good to employ a social prescriber that was just going to specifically look after people between the ages of 5 and 18, which is the period of time nurses would previously have covered. So as part of that, we had a sort of big campaign, a big digital campaign. So the messages from the leaflets went on to a sort of an app, and people could self-refer themselves in for help. We had paper copies, and we sent people into schools, and we tried to do a lot of local messaging, and we were on, you know, the local radio and things like that, and in the newspapers, so to try and let people know that we were there, and we were there to offer a service.